Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a couple tests that I find really useful in the clinic with regards to deciphering between a problem that might be occurring as a result of, it's called an SI joint dysfunction, which essentially with these issues, it's where there's too much movement within the SI joint. The SI joint essentially is an area between your sacrum and your ilium, which is part of your pelvis. And typically with individuals who have this, there'll be lots of weaknesses in the inner core muscle, pelvic floor, that creates torsion through that area and creates pain. And also a very similar type of test to distinguish between if somebody's having some form of nerve compression of some type. And the test is called a straight leg raise test. And essentially there's two ways that you can perform this test in order to decipher, perhaps as one of your clinical tools, to figure out if what the patient is experiencing is more of an SI joint dysfunction, or if there's something going on with regards to nerve compression of some type. And the test again is called a straight leg raise test. So essentially what I'll have the patient do is they'll be lying on their back like this, and if we're looking towards some form of nerve root compression, I would do a passive straight leg raise test where the patient will essentially lift up, or I will passively lift up the leg. And what will happen is there'll be an angle, a painful angle that will recreate shooting pain down the leg. It might cause also some numbness, some tingling. So some of the sensations that you would experience if you had sciatica: pain in the buttock, pain into the hamstring, shooting pain, numbness, tingling. Now with the SI joint dysfunction, the test is called an active straight leg raise test, where the patient will actively lift up the leg, and it will be quite painful to do. And the source of the pain when doing the active straight leg raise, there won't be any necessarily peripheral symptoms, but it'll be painful in that spot right in the back where the SI joint is situated. And also with that particular test, what we're looking for is the amount of movement and torsion, as I said, through the pelvis. The other thing too, typically with these straight leg raise tests, the one for sciatica, in a lot of cases, if you were to test the non-affected side, typically, not in all cases, but typically, in my experience, it won't provoke symptoms down the leg on the affected side, whereas if you do the same thing, so again, an active straight leg raise on the opposite side to where the pain is for an SI joint dysfunction, it potentially could cause pain in that respect. Again, a very, very helpful tool in the clinic and a great way to try and decipher between these two conditions. Thanks again for watching. Have a great day. Take care.